Hey everyone, I'm Grace, and today I'm going to be going over the certification for clinical exercise physiologists on the ACSM website. Before I get into like the PowerPoint and everything, I wanted to talk a little bit about the background of why this certification was kind of developed. Um, so ACSM developed the clinical exercise physiology certification to identify professionals with the skills to work in cardiac rehab. Not only is it cardiac rehab, but it's also promotes physical activity for people with chronic illnesses, chronic diseases, or conditions, and it allows professionals and practitioners to use evidence based practice to design exercise programs for their patients. And so the certification just is for allied health professionals who are working in a clinical setting or community or any public health setting, really. And so it was opened up for them as a little bit of an extension or more specific certification rather than the exercise physiology certification. So, some of the degree requirements on the website um, are listed here. I think that Um, it is important to note that they do have these degree requirements because I was looking at some other certifications and a lot of them um, don't require like as much hands-on clinical experience hours as ACSM, um, and just other curriculum isn't required to meet the requirements for the certification. So some of them like our transcripts, having accredited degree programs, supporting documents, and then just being able to show that you have had the correct content in your course history, and then having that hands-on clinical experience is huge for this certification. I wanted to focus on the job task analysis. I think that it goes into a lot of great depth as to what these clinical exercise physiologists are going to be doing. So, in terms of patient assessment, they review and assess medical records, interview patients regarding medical history, obtaining and assessing biometric data, monitoring patients pre health screening, and then they have access to patient goals, needs, and objectives throughout their course of treatment. Some of the exercise testing itself entails assessing symptom limited maximal exercise testing and other health assessments, administering and interpreting tests to assess muscular strength, endurance, flexibility, mobility, and other aerobic exercise tests. They also administer functional and balance tests. Um, some of those could be, like get up and go test, Berg balance, using the Berg balance scale, and then doing tests like selective functional movement assessments are great for these patients. They are also able to administer symptoms um, through exercise tests, which I think is cool. Um, Going on to exercise prescription itself that exercise physiologists in a clinical setting are able to do. They need to clearly communicate with their patient and be able to know how to use and explain all of the proper exercises and equipments that they're going to be prescribing to their patient, and also be able to tell them any reactions or symptoms that their patient may um, discover or like get from that exercise. Um, they design independent home exercise prescriptions. Um, they are always discussing and kind of counseling with their patients to know what is best, um, to know how to modify and evaluate exercise prescriptions based on what their patients need. So, a lot of these are very personal to the patient. That clinical exercise physiologists need to be able to have that clear line of communication with their patient to be able to um, better prescribe this exercise that they're going to be prescribing. There are other factors not included in my PowerPoint, but they do need to be able to show like exercise training and leadership. They need to be able to have an educational background and know how to um, deal with behavior changes in patients, and then also need to take into account legal and professional considerations that could come their way throughout the course of treatment with their patients. Some of the recommended distribution of clinical experience: um, cardiovascular, pulmonary, obesity, metabolic, orthopedic, musculoskeletal. These are all conditions or diseases that patients could have. On the left side of numbers is the amount of hours that a master's students need to have. On the right side, the higher numbers are what bachelor's degree holders need to be able to maintain in terms of hours. And then same screen, um, neoplastic diseases, frailty, behavior change, neuromuscular conditions or diseases. Same thing, master's hours and bachelor's hours on those different topics. There is a list of content requirements, things like clinical exercise testing and prescription, advanced exercise physiology, and then like pathophysiology, which is important for clinical exercise physiologists to be able to um, have this knowledge and know how best to um, administer and help their patients in a way that their patients won't get hurt, and in a way that their patients are going to respond positively to their treatments and to their exercise prescriptions. So I think that um, this is definitely what I'm interested in working with cancer patients. It's exciting to be able to read these kinds of requirements and know that I'm on track to be able to get certified if I wanted to, use my master's degree to be able to go into this field and work in this field with patients that I'm passionate about. So, yeah.